Hello, good evening, teacher. I am Harpreet Kaur, and here is my student ID card. Today, I am presenting the pathogenesis of clinical manifestation of asthma. Acute exacerbation of asthma plays a significant role in increasing the burden on the healthcare system. Do you know asthma affecting about 300 million people worldwide, which is expected to increase 400 million people by 2025? Let's move on the topic. As my topic for today is asthma, so I would like to give some information about asthma. Asthma is a chronic inflammatory airway disease that typically manifests itself as chest tightness, wheezing, cough, and dyspnea. All symptoms that are associated with airway obstruction. These conditions occur due to the obstruction of the airways as a result of thick mucus production, and this formation of mucus leads to narrowing of the airways. Furthermore, asthma can be atopic and non-atopic. Atopic asthma is a most common type of asthma which occurs due to the IgE antibodies response to any stimuli. On the other hand, non-atopic asthma does not involve an IgE response. It occurs due to the other factors such as dust, smoking, chemicals, and allergens. Asthma is more common in male children than female, whereas during adulthood it is more common in females than males. Moreover, mortality rate or hospitalization of asthma is high in indigenous people as compared to non-indigenous people. Next is pathogenesis of asthma. Asthma can occur at any age. In case study, Jackson Smith was first diagnosed with asthma when he was 2 years of age. After that, he definitely has some exposure or stimuli factors which trigger the symptoms of asthma. As we know, it is a airway hyperresponsiveness. So, if an asthmatic patient can come in contact with any of the allergens, dust, cold air, or chemicals, then these factors interferes in breathing, which ultimately leads to the symptoms like dyspnea, coughing, and wheeze. Let's move on to the case study. My presentation will cover the clinical manifestation of asthma. I will also highlight the pathogenesis of clinical manifestation by drawing on the case study of Jackson Smith. Jackson Smith, a 18-year-old, had a symptom of severe dyspnea severe dyspnea, tachypnea, SpO2 94% on room air, tachycardia, diminished breath sound, wheezing, and hyperinflated lungs. The first clinical manifestation I had like to point out is dyspnea. Dyspnea is also known as shortness of breath. It is most common symptom of asthma and occurs due to the narrowing or hyperinflation of airway, which ultimately leads to increased workload of breathing. Therefore, patients find difficulty in breathing and in unable to speak sentences. Another critical factor is tachypnea. Rise in tachypnea is defined as increase in breathing rate. Normal breathing rate is 12 to 20 breaths per minute. When it is more than 20 breaths per minute, condition is known as tachypnea. It is common in asthma as patient is suffering from dyspnea. Because of dyspnea, patient has difficulty in breathing. So for breathing, heart has to do extra work. So as the airways are narrowed, which interferes oxygen delivery to the alveoli. During acute exacerbations, this resistance is increased, leading to a rise in respiratory rate. A third area to be explored is SpO2 94% on room air. SpO2 94% on room air is also known as oxygen saturation. It refers to the amount of oxygen carrying hemoglobin in the blood. During an asthma attack, airways are narrow, which making hard to get air into lungs. Moreover, in asthmatic condition, patient has symptoms like cough. So, coughing uses more oxygen to clear lungs. Simply, body needs more blood. These elevation leads to disturbance in ventilation perfusion and resulting in hypoxemia, which indicate the decreased level of oxygen in blood. This condition leads to low SpO2 level and makes the symptoms more severe. Another major factor to discuss is tachycardia. Rise in heart rate is known as tachycardia. It occurs due to the lack of oxygen in the body. By explanation, due to the low oxygen level, heart requires extra work to do and resulting effect is increasing in heart rate. Another symptom is diminished breath sound and wheeze sound. Diminished breath sound is a condition when breath sound is hard to hear. It occurs due to the reduced airflow in severe asthmatic condition, whereas wheezing sound is most common in asthma patient. It is a high pitch musical adventitious lung sound produced by airflow through an abnormally or narrowed airway. In mild condition, wheezing is only and expiratory. As severity increases, the wheezes last throughout expiration. It occurs due to the bronchoconstriction or excessive mucus production. Last clinical manifestation to discuss is hyperinflated lungs. Hyperinflated lungs occurs when air gets trapped in the lungs and causes them to overinflate. Hyperinflated lungs can be caused by blockage in the air passages or by air sacs that are elastic, which interferes with the expulsion of air from the lungs. So, I would like to conclude my presentation by covering the clinical manifestation of Jackson Smith, who has been diagnosed with asthma. Here are my references. Thank you. Thank you for listening.